Have you ever wondered why some chiropractic care feels like guesswork, or why some adjustments sometimes help and other times they seem really inconsistent? This video is for you. I'm Dr. Norris Golberg from Koru Chiropractic in Louisville, and today I want to explain to you why measurement matters and why we use advanced imaging instead of guessing here in our practice. Because in healthcare, precision changes outcomes. Most people don't realize how much care in the world is based on estimation. Even good providers only work within the information that we have, right? Sometimes I have to guess, but I want to be as precise as possible. If you can't see something clearly, you're making your best approximation, and sometimes that works. That's why a lot of traditional chiropractic works. But when symptoms are persistent, when they're not getting better, approximation is just not good enough, right? And people come to us after trying many things. Maybe they've tried traditional chiropractic adjustments, physical therapy, exercises, medications, massage. Sometimes it helps, but when the results weren't consistent, that's a problem. And that inconsistency often is a measurable problem. Here's a key idea for you. You can't correct what you don't measure. The spine is a three-dimensional structure, and typically we take two-dimensional x-rays. And these two-dimensional evaluations don't catch up on subtle rotations, asymmetry, and alignment patterns, and can honestly be completely missed. It's not that the providers are careless or reckless, but it's just we were limited with tools and technology. When the measurements improve, the precision improves, and when the precision improves, the results improve and they stabilize. We use CBCT imaging, which stands for cone beam computer tomography. In simple terms, it allows us to see, that's this machine right here, your spine in 3 dimensions instead of just seeing those flat 2-dimensional x-rays. And especially in the upper neck, that matters because there's a ton of neurological sensitivity at the top, there's a ton of motion in the top, and the joints are shaped completely different. There's no disc, and it really needs to be treated in a different way than just twisting, cracking, and popping. See, these small asymmetries, they can create disproportional distress on the nervous system. These little twists and shifts and subtle misalignments. Without 3D imaging, you're estimating the angles and the relationships, but with the imaging, you're measuring them. You're seeing your spine in 3 dimensions. And that allows us to be as specific and gentle as possible. And specificity, again, isn't about force, it's about accuracy, right? So this gentle adjustment delivered on a very precise angle based on your unique misalignment allows us to deliver a very approximate adjustment. And we're not trying to move the bones aggressively, we're trying to move them gently and give your nervous system a clear idea of where it's supposed to be holding that alignment. And that's really what helps us get the best long-term results and the best stability in your spine, so you're not having to come back over and over again. Some people hear imaging and they get worried about, surgery or maybe a really aggressive treatment, and it's actually the opposite. The measurement and the specificity allows us to be more conservative with your care and understand the exact mechanics that are going on in your spine so that we don't have to guess. We can be precise, we never overcorrect, and ultimately, again, the precision reduces force and it reduces repetition. Precision makes it also safer and more efficient for all kinds of patients. At Koru Chiropractic, imaging isn't about technology for the sake of technology, it's about clarity. When I had a chance to get this machine, I invested a lot of money for the benefit of the patient, more than the benefit of me. Although it helps a lot because, again, I know I'm being more precise, all about clarity, right? I want to feel clarity and I want to feel confidence when I'm adjusting your spine and knowing exactly what is happening. And even after I do the adjustment, I can go back and scan you again and understand how did I make the changes and what's working and what's not. No trends, no routines, no assumptions, no fancy modalities, just data-driven care. So if your symptoms have been inconsistent or your care has helped, but it's never really stabilized, and it's not necessarily a failure of the treatment, it's just a lack of measurement in many cases. From what I hear when patients come to my office with that complaint, and fortunately they're coming to me because that's exactly what I do. I'm precise, I'm gentle, and if this sounds like your story, if you're trying to get clarity with what's going on with your spine-related health conditions, then I'd love to help you out. Again, Dr. Norris Golberg here at Koru Chiropractic in Louisville. Hope you stick around for our next video.